Welcome to this week's edition of Cardiovascular Updates, covering the latest breakthroughs, brought to you by LucidQuest. Verquvo in the Phase 3. Victor trial missed the primary composite of cardiovascular death or first heart failure hospitalization in more than 6,100 stable heart failure with reduced ejection fraction patients on intensive guideline therapy. A numerical reduction in cardiovascular mortality was seen, but wasn't formally tested after the primary miss. Pooled Victor plus Victoria suggests about a 9% reduction in the composite, with full details awaited. Sotagliflozin showed consistent relative risk reductions in total cardiovascular death and heart failure events, and in MACE across age groups, including patients 75 and older, in a post-hoc pooled analysis of SCORED and SOLOIST, with roughly 11,800 participants and a median age of 69. For obstructive sleep apnea, pooled randomized data in 3,549 patients with obstructive sleep apnea and cardiovascular disease over about 3 years, suggest continuous positive airway pressure reduces cardiovascular risk in high-risk obstructive sleep apnea, but may increase it in lower-risk cohorts, pointing toward risk stratified rather than universal use. AstraZeneca's oral PCSK9 inhibitor AZD0780 has an active, quadruple-masked global Phase 3 MACE-PLUS outcomes trial that began in May 2025, with an update filed September 4th. In Chagas cardiomyopathy, the PARACHUTE-HF randomized trial, led by Renato Lopez and supported by Novartis and BCRI, reported a reduction in a prognostic biomarker, marking a first in chronic Chagas heart failure. In heart failure with preserved ejection fraction, a higher systemic immune inflammation index was associated with worse outcomes in an observational study cohort, highlighting inflammatory pathways but warranting cautious interpretation. India completed the first multicenter trial of the Supernova stroke stent retriever. Early signals suggest safety with more than 50% cost reduction versus standard devices, though detailed outcomes were not reported. In atrial fibrillation surgery, Pulse Biosciences received FDA IDE clearance to begin NANOCLAMP AF, a single-arm study of up to 136 patients using non-thermal nanosecond PFA. The system holds breakthrough device status, and European feasibility exceeds 40 patients. From basic science, Mass General Brigham researchers report that the neutrophil protein RELMI, also known as resistin, damages cardiomyocytes and triggers ventricular arrhythmias after myocardial infarction in mice. RETN is elevated in human infarcts, and gene deletion reduced arrhythmia burden, published in Science. For pediatric congenital heart disease, Longeveron's ELPIS II is a randomized Phase 2b trial of 40 infants with hypoplastic left heart syndrome at 12 U.S. centers, delivering intracardiac laromestrocel or Lomecel-B during surgery. Early phase data suggested a 5-year survival signal with favorable safety to date. Finally, cardiac MRI quantification of late gadolinium enhancement at or above 7.2% in dilated cardiomyopathy, stratified sudden cardiac death risk more robustly than qualitative reads in 837 patients over a median 58.3 months, published in Radiology 2025. Stay ahead in cardiovascular research. Like, share, and subscribe for weekly updates. Visit lqventures.com or email us at info@lqventures.com for expert healthcare consulting. See you next time.